Good morning! Caritas Health Shield, your health maintenance organization. Our vision, families that are assured of the proper health care when they need it. Our mission, to provide the best health care for Filipino families today and tomorrow. Consistently among the top health maintenance organization companies to do business in the Philippines. Our board of directors, Chairman, Dr. Rene V. Reyes, President and CEO, Mr. Mariano T. Katipunan Jr. Our board of directors, our corporate secretary, we have 76 branch offices and 15 Clinica Caritas strategically situated nationwide to attend to your membership concerns and to take care of your health care needs. Metro Manila branches, Central Luzon branches, Northern Luzon branches, Mindanao branches, Visayas branches, Southern Luzon branches, which include Antipolo, Cainta, Batangas, Lipa, Lucena, Naga. Clinica Caritas branches, E. Rodriguez, Head Office, Cubao, Lagro, Makati, Monumento, Sucat, Taft, Tuguegarao, Baliwag, May Kawayan, Antipolo, Cainta, Cebu, at Davao. Nationwide network of accredited providers. Over 14,000 doctors representing the widest range of specializations. Over 400 hospitals nationwide. Over 250 diagnostic clinics and laboratories. Over 150 dentists. And the accreditation of providers continues. Caritas Health Shield is a member of AMOPI. AMOPI, being an association comprised of several HMO companies, has thousands of accredited doctors with a wide field of specialization. The Unified Service Agreement between AMOPI and CHS states that all our members can be provided with medical attention by all its accredited physicians, thus giving our members access to more physicians on top of over 14,000 CHS doctors of medicine. Kiddie Health Plan. Secure your child's future. For kids 31 days to less than 7 years old. Our members will enjoy 2 periods of coverage. Paying period coverage for the first up to the 5th year and the bonus period coverage from 6th to the 10th year. Example, planning, T. Number of units, 10. Yearly maximum coverage, 40,000 pesos. On the first year, he'll enjoy the 40,000 pesos maximum coverage. But yearly it is increasing. On the second year, it will be 45, and so on and so forth. Up to the sixth year, it is 70,000, and that will hold true up to the 10th year. Medical expense benefits. These are the benefits that are deductible from your yearly aggregate limit. Medical expense benefits, hospitalization benefits, special diagnostic and laboratory procedures, emergency care, and maybe outpatient services. Medical expense benefits, hospitalization benefits, room and board, services of accredited physicians and specialists, laboratory tests, X-rays, and other diagnostic exams, use of surgical or medical equipment and facilities, namely operating and recovery room, ICU, etc. Administration of anesthesia and or oxygen. Transfusion of hospital-provided blood products. Dressing, conventional cast, and other medical supplies. Prescribed drugs and other medication used during confinement. Medical expense benefits, special diagnostic and laboratory procedures, X-ray, CT scan, 2D echo, ultrasound, MRI, EMG, other procedures deemed appropriate by CHS. Medical expense benefits, emergency care. The member is in severe pain or imminent danger of death or disability due to an accidental injury or a sudden unexpected onset of illness. Actual costs in accredited hospital. If in non-accredited hospital, reimbursement of 80% of cost based on CHS standard rates. Ambulance service not to exceed 2,500 per availment from non-accredited hospital to accredited hospital to another accredited hospital. The member or the member's representative should notify CHS within 24 hours. Medical expense benefits, MEB outpatient services. Treatment of minor injury or illness. Minor surgery not requiring hospital facilities. Eye, ear, nose, and throat treatment. Circumcision and ear piercing. Membership privileges. These are benefits not deductible from your yearly aggregate limit. Membership privileges. Annual well kitty checkup, preventive health care, emergency care, dental care, outpatient services, other services. Membership privileges, annual well kitty checkup, taking of medical history, medical examination, growth assessment, nutritional assessment, developmental milestone assessment. Membership privileges, preventive health care, periodic monitoring of health problems, consultation on diet, exercise, and other healthful habits. Flu and pneumonia immunization, excluding cost of drugs or vaccine. Membership privileges, dental care, 4 consultations per year, annual oral prophylaxis, 4 times a year tooth extraction, 4 times a year temporary filling or recementation, treatment of oral pain and lesions, wounds, and burns. Membership privileges, outpatient services, 12 consultations per year. Membership privileges, other services, 24/7 special medical hotline assistance, discounts on non-covered health services at selected hospitals and clinics, two-way payers insurance benefits, credit life, waiver of installment due to disability, plan transfer, original member. The transfer is age, which must not be lower than the age of the member at the time of the transfer, must not be more than 18 years old upon expiration of the contract. Terms and modes of payment. Spot cash, one-time payment with 10% discount. Annual, 5 installments once a year. Semi-annual, 10 installments with model charges every 6 months. Quarterly, 20 installments with model charges every 3 months. Pay your Caritas Health Shield plans at any of the following: CHS Sales Associate, CHS Cashier, online credit card payment, over-the-counter banking, payment outlets, mobile application, online bank transfer. Payments made on or before the due date, active in force plan. Non-payment on the due date, lapse plan. Caritas provides a grace period of 1 month from the due date. Installment due unpaid beyond the grace period of 1 month equals terminated, no force or effect. The member loses all rights and privileges except the right to reinstate. Requirements for reinstatement. A. Submission of an application for reinstatement and payment of the reinstatement fee. B. Choose from the two options of updating. 1. Payment of all unpaid installments plus surcharge of 1.5% per month from the due date of each unpaid installment. One-time update. 2. Payment of one installment redating subject to the prevailing rate. One model payment. Non-payment of plans within 2 years will be considered as canceled without need of notice. Exclusion from healthcare coverage. Number 1, self-inflicted or induced injury or illness, or if arising out of attempted suicide, commission of crime, violation of law, or due to unnecessary hazardous activities. Drug or alcohol-related abuse or dependency, cosmetic treatment and or surgery, and other forms of surgery for beautification and procurement of eyeglasses, braces, hearing aids, prosthesis, appliances, including procedure and rehabilitation. 4. Home-based rehabilitation services, cardiopulmonary rehabilitation, and take-home medicine or medical supplies. Exclusions from healthcare coverage. 5. Pregnancy-related medical care, childbirth, miscarriage, abortion, sex transformation, artificial insemination, treatment of infertility or sex sterilization. 6. AIDS, AIDS-related and sexually transmitted diseases. 7. PE for insurance, employment and the like, and other medical services not incident to the treatment of an illness or injury, including medical legal fees. 8. Psychotherapy, counseling, and treatment of mental or psychiatric disorders, anxiety and or stress-related conditions, psychosomatic illnesses which may present as paroxysmal dyspnea, neurocirculatory asthenia, hyperventilation, and the like. 9. Open heart surgery, coronary angiography, percutaneous transcoronary angioplasty, pacemaker insertion, complicated hypertension, organ transplant, or hyperalimentation. 10. New modalities of diagnostic procedures and treatment, including but not limited to robotic surgery, stem cell therapy, etc., unless deemed appropriate by and upon prior approval of Caritas. 11. Cranial surgeries, including but not limited to gamma knife procedures, except if accident-related. 12. Executive checkup and confinement, which are for purely diagnostic purposes, and any diagnostic procedures or lab exam to screen disease entity. 13. Catastrophic conditions defined as dreaded diseases acquired prior to enrollment with Caritas. Pre-existing illness or injury, if disclosed, membership may still be accepted, and our company, Caritas Health Shield, may choose to cover the said illness on the second year or cover the said illness on the third year if it would need a major surgery, or impose a waiver of coverage for said illness, injury anytime. Pre-existing illness or injury, if not disclosed, Caritas Health Shield may declare the contract null and void from the beginning, forfeit all payments made by the member, or seek a refund of all expenses it may have incurred. Pre-existing illness or injury, an illness or injury is pre-existing if, before the effectivity date of the plan, A, its cause origin is clinically determined to have already started. B, it has manifested certain signs and symptoms. C, it has been diagnosed as such. Utilization of benefits. The member may avail of healthcare benefits from any Clinica Caritas facility or any other designated CHS accredited service providers. However, unless an emergency exists, he must give timely notice to and secure a letter of authorization from CHS before any confinement, treatment, or consultation of the member. To secure an LOA, please contact the 24-hour medical hotline numbers. Call, text, or email. For non-medical inquiries, you may contact the following: call, text, or email. Thank you, and God bless.